Hi everyone, in this video we are going to study about the auricle, also called as pinna. Pinna or the auricle is the part of the external ear. External ear is divided into two parts. One is called as auricle or the pinna, and the other part is called as external auditory canal or the auditory canal. These both have the same function, gathering the sound waves and make them reach the tympanic membrane. This is the function of the external ear. Okay. Now as you can see, our ear has so many elevations and the depressions, and we will name them and we will study them. This outermost part that you can see, wait, I will change the color. This part, this is called as helix, and there is one more protrusion, this one opposite to the helix. This is called as anti-helix. Okay, and the part which is depressed here, this is called concha, and the part that protruded just opposite to the external auditory canal, that is called as tragus. Opposite to the tragus there is one more protrusion, that is called as antitragus. Okay, now you are seeing the depression here. This is called as symbiconch, and the symbiconch and the conch are separated by crus of helix. Okay, and now you can see there are two more fossa. As this the anti-helix will go further, it will divide into two, forming a triangular fossa. And here in between the helix and the anti-helix you can see one more fossa, that is called as scaphoid fossa. And these are the parts. Usually you might have observed that there will be a small notch. You can appreciate here, I think this type of notch will be there in some persons. It will be seen. This is called as Darwin's tubercle. As the word suggested, Darwin, it is something to do with the evolutionary basis, right? So according to evolutionary basis, what happens is that usually the quadrupeds, take cow's ear will be pointed at some point lateral to the lateral part of the pinna, right? This, if you consider this is the ear of cow, of course it is not looking, consider ear of cow, this part, this will be pointed in the quadrupeds, right? So as we have evolved, this will be rudimentary in our cases, rudimentary in our cases. Okay, now we will come to this part. This is called as lobule. It contains fibrofatty tissue. Do you know, except this part, the entire ear, this is made up of crumpled yellow elastic cartilage. Okay, entire thing except the lobule is made up of crumpled yellow elastic cartilage. This is about the mm, different structures that I explained over the pinna. Now some applied aspects. As you know, uh, there is a cartilaginous part. In that cartilaginous part, there is one gap that is called as incisura terminalis. Okay. So when there is gap and there is no cartilage, we can use it for surgery. So any incision that take over this does not cut through the cartilage. Okay, right. So and the external ear is mainly used for grafts, mainly used as grafts. So it can be used for reconstructive surgeries of the middle ear. For example, for this we can take cartilage from the tragus, pericardium from tragus or the concha, or the fat from the lobule. These things can be used for the reconstructive surgeries of the middle ear. And it can the conchal cartilage, I will show you it. This part, the conchal cartilage, can be used for correcting the depressed nasal bridge. This image you can see, this is our nasal bridge, right? So if it is depressed, the conchal cartilage can be used to correct this one. And for also correction of the defective ala of the nose, we can use the composite graft that contains both skin as well as cartilage from the pinna. Okay, these are the different structures from the ear that can be used as the grafts. Now let me talk about the nerve supply. Our ear has both motor as well as sensory nerve supply. Okay, the motor nerve supply is mainly by the facial nerve. You must notice that there will be three muscles which are rudimentary. These three muscles that attach the pinna are anterior, superior and posterior auricularis. I feel little bit difficult to pronounce this auricularis, so okay, no problem. And usually we can't move this because these are rudimentary, but I can move because I have special talent, Okay, let me talk about the sensory supply. This image is everything about the sensory supply of the external ear. These two parts, both medial as well as lateral, will be supplied by the same type of nerves. For example, the great auricular nerve from the C2 and C3 branches will supply the lobule, helix, antihelix, or all this part. Okay, and the auricular branch of the vagus nerve is supply the conchal region. Okay, and the auriculotemporal nerve, as the name says, here it will be a temporal part, right? So this is ear, auricle, and the temporal. So auriculotemporal nerve will supply the anterior as well as the superior part of the pinna. Coming to the medial aspect, as you know, auricular branch of the vagus nerve supply just posterior or medial to the concha, this conchal part, as well as the great auricular nerve, it supplies other most parts, and also the lesser occipital nerve. This one is just changed here. Observe, auriculotemporal nerve on the lateral aspect and the lesser occipital nerve usually the medial aspects of the superior part of the pinna. Okay, as I said earlier, this is Darwin's tubercle. Sorry, my handwriting is not that much good. Okay, however I am writing nice on this board. One clinical note, the Ramsay-Hunt syndrome. You can see different types of lesions over this conchal region because of the auricular, I will change the color, auricular branch of the vagus nerve, which contains the branch or the supply from facial nerve from the geniculate ganglion. Usually in the herpes zoster infection of geniculate ganglion. So I think most of the part I have covered. If you have any doubts, please drop down them in the comment box. Usually I used to read the lines here, but first time I tried to explain. If you felt it is good, just tell me it's good, or otherwise whatever the review is there or the feedback is there, just tell me. I will try to improve myself and I will try to be consistent as much as possible. Thanks.